Before we dive into today's episode, we'd like to take a moment to thank two of our incredible patrons, the Veterinary Information Network Foundation and Worldwide Vets. The VIN Foundation provides veterinarians with essential support, resources, and education, helping advance the profession for the benefit of animals and communities. Worldwide Vets, dedicated to delivering global veterinary aid, works tirelessly to improve animal welfare and provide veterinary services where they're needed most. We're grateful for their commitment to the field and their support of our podcast. Thank you for making this all possible. Hey pre-vets, this is Michaela, your 2024-2025 webmaster, and I'm so excited to introduce you to Dr. Christy Newberry, psychologist and embedded clinician at the Auburn College of Veterinary Medicine. Dr. Newberry, why don't you tell us a little bit about yourself?
Sure. I have been a psychologist at the Auburn University Student Counseling and Psychological Services for almost 7 years now, and I transitioned to the College of Veterinary Medicine a little over a year and a half ago.
Okay, so what made you decide to pursue a career in psychology and join the College of Veterinary Medicine about a year ago, since you had spent, some time in general practice, I assume?
So actually, I've worked with college students throughout most of my career. During graduate studies, I worked at the counseling centers there at the universities that I was at, and just found that it was a really good fit for me and enjoyed working with the college students. And when the position opened up for an embedded clinician here at the College of Veterinary Medicine, it was very appealing to me. I love a vet, and I've been had some really good experiences with veterinarians as a pet parent, and just was really drawn to the population.
Right, I was going to ask if you had any pets. You got a dog?
I've got a dog. I've had a lifetime of pets. My current little dog right now is a shelter named Joy.
Oh, all right. Well, what exactly does your role look like day to day? What do you come into your office, and from then on, what does it look like?
The majority of my time is spent in individual therapy, and so I might meet with 5 or 6 or 7 individual students a day. But in addition to that, I'll also do outreach. We offer workshops. We've done like an understanding grief. We've done self-care and stress management, a lot of different workshops that we'll offer, either to the classes or after hours. I'm also, I'll consult with faculty and staff if they have student concerns. And then I'm part of the Office of Academic Affairs at CVM.
So I don't know about at other colleges, but at Auburn, this, embedded clinician, do you think that's a beneficial thing? Is it confidential? Is it, from the student perspective, what are their advantages to coming to psychologists?
It is absolutely confidential. It is the same as if they went to a psychologist or a counselor off campus. Or on main campus. We don't disclose that any student is a client of ours. They are welcome to disclose that, but of course we would never confirm or deny that we see anyone. All of the information that they share is completely confidential with just some safety exceptions. And so that's definitely one of the things that we emphasize is just because you're seeing an embedded clinician, we are still legally and ethically bound by confidentiality. And so we are not going to be sharing your business with other students, with faculty, with staff. So it's completely confidential.
Okay. I know you have a clinical interest in compassion fatigue, anxiety, and burnout. Could you explain exactly what compassion fatigue is to those that don't know?
Sure. Well, there are actually a lot of different thoughts and definitions about compassion fatigue. The one that I'm most familiar with is research done by Charles Figley, and he identifies compassion fatigue as basically the cost of caring. And so sometimes it's referred to as like vicarious traumatization or secondary traumatic stress. And it's just the result of working with people and pets who are suffering or in pain, and just sort of the toll that can take on people. And it's actually statistically a lot less prevalent than I think some people might imagine, because it's not a given. There are things that people can do to mitigate that, and a big part of that is just making sure that your own needs are met and practicing good self-care.
Is seen in much higher rates in vet students than, maybe practicing doctor, or the vice versa? Are they about equal?
I wouldn't be able to say like specifically, but I know that it's prevalent in a lot of groups for nursing and even family caregivers. And it seems like there's been increasing amounts of research done with veterinarians. And so I think there's more, maybe the light is being shined on that more right now.
Yeah, I know that I hadn't really heard about it until I was kind of doing my research on you, and I was like, okay, that makes a lot of sense, actually.
Yeah. I mean, because it's,
there's a name for it.
Right. At any time we're working with people or animals, and, we're, by nature, very compassionate people. Typically when I've met veterinarians or pre-veterinarians, that, are very compassionate and empathic, and, it takes a toll after a while if you're not taking care of yourself.
I agree. I totally have experienced that, and I know many people have, even in undergrad. What keeps you motivated and passionate about your work in the unique setting of college?
Sure. I really love the students. They're a great group of students. They're hardworking and energetic and conscientious. And so the students, are my primary drive, but also feeling valued and feeling supported by the academic staff, by the dean, by the associate dean, just having the opportunity to be part of the community, as opposed to, students who just come, or clients who would just come and meet with me individually and then go about their day. But I actually get to be, kind of a small part of their world, and be involved in more things.
Right. Does it feel like you've learned a lot more about veterinary medicine after getting into this role, or did you?
Absolutely. Yeah. There are so many things that I think that I had no idea about. And I also think that kind of the general public probably has no idea. And one of the things was just how rigorous the program is and how intense. And I previously worked with medical students at an internship that I did at a college. And I think people have more of an understanding of how rigorous medical school is and how demanding. But I think there are a lot of misconceptions as far as what actually goes into being a veterinarian. And sometimes that might equate to getting less support, or people understanding less, how it is and the time that it takes, and the energy.
Yeah, that's something that I did want to talk about with you. So some misconceptions about, the mental health of veterinary students, but also misconceptions about, like you said, their schooling in general. I know that a lot of people have told me, not a real doctor, that phrase kind of goes around. Do you see a lot of students feeling kind of invalidated by those misconceptions and ideas?
It's definitely a topic that comes up, and even, in their own families, their family members not understanding. Well, if you're going to, go into this much debt and have this much time invested in it, why don't you go and be a real doctor? And not really understanding maybe the value. And I don't know that maybe society in general recognizes like how much work really goes into being a veterinarian.
Yeah, and I think that specifically for pre-vets, not a lot of people understand the application process. All of us seniors / juniors might have just submitted their applications. I just submitted mine early August. So that was a process in itself. You have January to September just for the application, and then it's months of like anxiety and just stress and waiting to hear back. And there's just, the acceptance rates are so much lower because there's so many less vet schools, and vet schools are trying to move to a more holistic review process and whatnot. But whenever you tell somebody I'm applying or something, I don't think they quite understand the scope of stress that brings on a student compared to med school, which is equally as stressful, but there's higher chances of getting in. So that stress is slightly taken away.
Well, and I also think that in general, people typically have an idea, from watching TV or different shows, like, well, this is what it takes to, once you're in med school, and all of the work that goes into it. Whereas, I've had people who didn't even realize that veterinarians were doctors. Yeah, not appreciating and necessarily validating, like you said, like how difficult it really is.
Yeah, I think that's a good point. Seeing representation in the media, I don't know if it's necessarily necessary, but it would really help kind of mitigate some of those ideas. I mean, nobody's really making a veterinarian Grey's Anatomy.
Right.
Maybe Dr. Pohl.
Right.
He's not a med student exactly. So that's kind of where we're at with that. But I think people enjoy looking at the day-to-day life of a veterinarian based on those shows.
Right.
We all know that veterinary students and professionals face high levels of stress. We all know that veterinary students and professionals face high levels of stress. What are some of the unique mental health challenges that they encounter?
Well, what I found some of the more unique challenges that I've noticed here at the vet school as opposed to on main campus when I've worked with other graduate students is the time commitment. You know, if in other programs, you know, they might be in classes for a few hours and then they have a lot of time to work on projects or prepare for exams. Whereas here, you know, they might be in class all day, every day, with few exceptions, and then have to go and prepare for exams and review the materials and, you know, do quizzes and projects and all kinds of things in addition to their just normal 8 to 5 class load.
Yeah, I know that one thing that I've thought about and that I've heard is you can't have a job in vet school. You know, it is a full-time job. So do you see a lot of people with financial stresses? Does that bring a lot of stress to people? Just the time commitment affecting their ability to work for, you know, financial stability?
Absolutely. And sometimes they have, you know, partners or parents or family members who are able to help with that support. And some vet students do manage to, you know, work a few shifts here and there just to try to supplement their income. But yeah, finances are a considerable stressor because a lot of them, you know, work through parts of undergraduate and now, you know, not being able to have that time and not being able to allot it to working when they've got so many other demands.
Right. And on this same financial note, you know, you're not a financial advisor or anything, but just from talking with students, is the kind of debt crisis as bad as it seems, in a way to phrase it? Does that really affect students as much as, you know, pre-vets and undergrads are told? And, you know, they really hammer that it's a lot of money and you're going to be in debt for a long time.
Right. Well, since I primarily work with students who are pursuing their doctorate, they're like, I get their perspective of it. And so right now it's hard to imagine, I think sometimes for some of them, like what it's going to be like once they actually have a salary and that income coming in and how they're going to manage, you know, that debt. So I think right now it does weigh pretty heavily on some. And, you know, I also work with residents and interns at the hospital who, you know, are specializing. And so there is a lot of financial pressures, and because vet school is really expensive. And then, you know, you mentioned the difference between human medicine and veterinary medicine earlier. And one of them is, you know, like the earning potential is not at what it is for a human doctor as it is for a veterinarian. I'm sorry, I misspoke. It's not as the earning potential for a human medicine doctor is a lot greater. And so, but you might leave school with as much debt.
Right. Yeah, that debt to income ratio.
Right. Thank you. Yeah.
Of course. No, I've got it. So all of this being said, whether it's financial, the compassion fatigue, just academic stress in general, what strategies do you use to support the mental health of these students?
I just individualize my approach to what they're coming in with. And if, you know, and it might be different from session to session or, you know, month to month, but just helping to equip them with, you know, like you said, the strategies. And a lot of that really is, I mean, the students that I work with here are very resourceful. They're obviously very intelligent and hardworking. And so sometimes it's, you know, there are skill deficits that need to be addressed, and learn those skills, then they're able to manage those things a lot more effectively. And so that's what I do primarily. And then, you know, as far as helping them to learn additional skills to manage that anxiety, you know, because we mentioned about there's a lot of stress, and it seems that people who are attracted to veterinary medicine and to pursuing that are very driven, and some have some very perfectionistic tendencies. And so being able to help them kind of set more realistic expectations and manage that anxiety that comes up is a lot of what I do day to day.
Right. I know amongst me and some of my classmates, a lot of us struggle with, like you said, one. I know I personally struggle with OCD, being diagnosed with that. Does that seem to be a trend amongst almost all of them, or is that 50-50? Because I think you kind of have to be a little bit to get in, but once you're in, is that anxiety about, oh, I need to be perfect to get in? Does that kind of fall away a little bit? Is that relieved?
Right. Well, and so the students that typically come for therapy are the ones that are still dealing with those, anxious thoughts and those perfectionistic tendencies. And so I think for some, it really does dampen down. And so they're able to manage that a lot more effectively earlier on. And for the ones that it persists, then hopefully they'll make their way here and we can work with them on, okay, how can we set those more realistic expectations now that you are here? And it's a lot, the demands and the challenges are a lot different and a lot more intense. And so if all along you were like, I've got to make an A, I've got to make the highest grade, when the entire population is, are very elite high achievers, then, it can be jarring for some.
Yeah. I think that a lot of students, pre-vet, veterinary, even after that, they're trying to set goals and expectations for themselves that nobody expects of them. Always trying to be first done, best done, and I don't want to say it doesn't matter, but there's other things to focus on, and that's not something to stress about. I see it all the time. I do it myself.
Mm-hmm.
I don't know.
And it's not that it doesn't matter, it just matters a lot less. You can only give so much, and if you're giving everything to that, then that leaves a lot of other gaps in other areas of your life. And so I think it's really important to be able to find that balance. And yes, instead of, I talk a lot with students, like instead of rewarding outcome, like reward efforts and focus on your efforts, because a lot of times, outcome is completely outside of our control. Whereas we can determine how much effort we put into it, and that will lead to a positive outcome for the most part. But if you focus on like, okay, I'm going to invest my effort and my energy in this way, and making sure that it's reasonable and that it's not just focused on school, because there's a lot of other parts of life.
Yeah, that's an amazing way to put it. I would not have thought about that.
Mm-hmm.
That's really awesome to think about. Put everything back in a different perspective,
Mm-hmm.
Like you said, effort versus outcome. Organic chemistry for pre-vets. The effort might not always match the outcome, but hey, you made it through.
And it's important to focus on, like, am I learning? What am I grasping?
Yeah.
Like the grade might not necessarily reflect all that you've taken in and the understanding that you've gained. And so I think if you're just focused on, well, that grade and that outcome, that can be really disappointing. But if you're thinking, well, yeah, but I understand this and I can explain this, then that focus, that shift, I think can make a big difference.
Yeah, and feeling accomplished and being able to, you always hear it, the best way to learn is to teach other people.
Mm.
And like you mentioned, being able to teach other people, you're like, wow, I really get this. I feel really cool.
Right.
Even if I, made a C on that test, here I am.
And nobody's ever asked me what grades I got in graduate school. And I've never even thought about asking my vet, who is amazing. And so, for all I know, she got a C, but she does great work.
Exactly. And it's just hard. Like I said, for pre-vet, getting in
Mm-hmm.
and focusing on those GPAs, even for more holistic schools, that's still a factor. When you have 2,000, 1,000 qualified students, how do you differentiate? How do you say this experience was more valuable than this experience?
Mm-hmm.
You have to kind of shift focus to GPA a little bit. And then among that, everything's so individualized from different colleges. My experience in OChem isn't the same as somebody that goes to, I don't know, University of New York or something.
Right.
It's just hard. You can't expect the same out of everybody in different circumstances. So are there any particular moments during vet school that tend to be challenging for students?
I think as far as maybe particular moments go, I think a lot of time commitments, and then you might have a couple of exams in the same week, and then, trying to balance all of that. And, it's covering a multitude of lectures and trying to, So I think rather than having like, midterms and finals are stressful times, that it's different for different classes depending on the demands. But in general, I know that when students start surgery labs, sometimes that can spike some stress. And then also when clinical rotations start, because people have gotten really, really good at being students and learning and sitting in a classroom. And now, it's exciting that they're being able to, do more hands-on things, but it also can be kind of scary.
Yeah, and I was going to ask, I know most schools follow a first through fourth year model just by terminology. And that fourth year or third and fourth year are usually your clinical versus, the first didactic years.
Right.
Do you see any considerable changes in stress levels between those two sections? Is one higher than the other? Are they about the same because of the equal but different challenges?
Right. I think a lot of it is individualized, and some of it is, some people have spent so much time in class working so hard on academic work for so long that they're just sort of at their limit. And so that can be more challenging. Whereas for a lot of people, I mean, like you said, how difficult it is to even get into vet school, like that's kind of their jam. I mean, they're like, yep, I can do class. I can, retain and read and, regurgitate all the material. And so actually going, okay, and now here's a scalpel and I have to start surgery, that can be, a real stressor for some. Whereas for others, it's like, okay, I don't enjoy sitting listening to lectures. That's not where I thrive. But, I've had really good experiences in vet clinics. And so now I'm getting to do those hands-on things, and so I think there are spikes for different people at different times.
Okay.
But probably that levels out over time.
Yeah, that makes a lot of sense. We've talked a lot about the different mental health concerns and how it can kind of vary between students, between the years in their time here, between the months in their time here. At what point and what advice would you give to somebody who might be hesitant to seek help for their mental health concerns? Would you say to kind of start early before you think something is going wrong? Or do people tend to do better once they're kind of in that situation, when they're facing high levels of stress and they decide to finally come to counseling, therapy, whatever you refer to it as?
We generally encourage people to start early and establish a relationship, so that way, when things start to get harder, they already know, like, okay, I've gotten to know this person. I feel comfortable. I feel like they're a support and a resource that I can fall back on. But, anytime is a good time to come, because, anytime you recognize, like, okay, I need a little bit more support or I'm struggling, that we definitely encourage students to take advantage of the resources that they have available. Because life is hard, vet school is hard, and we aren't meant to struggle alone. And so if there are resources available, definitely take advantage of those.
Yeah, and what advice would you give somebody that's a little bit more hesitant or scared or skeptic about coming to therapy?
To be brave and take a chance, to talk with people who have had positive therapy experiences, and because it really can be life-changing. And what do you have to lose? You might gain a really good experience. You might be able to address, concerns that you've had and learn new skills. And so just to try it out.
Yeah, and there's just so much emphasis on self-care, mental health now, which is an amazing thing.
Absolutely.
Whether it's undergrad, high school, college, veterinary school, anything. How has this increasing awareness of mental health issues impacted the culture of vet school? I know you haven't worked in it very long, but just, do students see that other people are aware of it and encourage self-care and just taking time to nourish,
Sure. Well, I think the fact that Auburn has 2 embedded counselors in the College of Veterinary Medicine is a testament to how seriously they take student wellness and student mental health, and just the culture and the support for seeking services is definitely evident. And the dean, the associate dean, they make it the faculty and staff, clinicians, once the students start their rotations, really support students in getting, the resources that they need, the help they need. They try to make it as easy as possible for them to come to therapy. And that's one of the benefits of having embedded clinicians is, we're literally right beside the vet school. So, it's a 3 to 5 minute walk. You're here for 50 minutes. You've missed one lecture but it's not like they have to go somewhere and wait and all of that. And so, there are a lot of benefits of having embedded clinicians. And some of those, how demanding it is. And so vet students don't typically feel like they have to go back over and kind of explain like their day to day, and we know what classes are more demanding and are more stressful. And so and also just being familiar with the day-to-day interactions of faculty and staff and students. And
Yeah, do you find yourself kind of just researching some of the trends and whatnot just for fun to stay updated on whatever might be going on with the students? Or is it just kind of like you go off what they tell you and you see those trends there?
it's a little bit of both, because I realize that it's only a subset of the population that comes in, and I know, more details of their day-to-day lives, but also just into other resources like on other campuses and talking with other embedded clinicians at vet schools and kind of learning more about how they're managing things, the kinds of things that they're facing. And then also being part of the Office of Academic Affairs with CDM, that helps, we know a little bit more about kind of what's going on from an administrative level. And like we attend the dean's hours, and so that way we can kind of hear what's being relayed so that we can, be supportive of the students in that way.
Yeah, I think that's super helpful to feel like you don't have to explain yourself for the more minute things. You can focus more on your personal experience rather than explaining, well, here's what we're doing today, if you didn't know,
Right.
to, kind of a extramural psychologist. I think the main message from Auburn specifically, and I'm sure any college, whether they have an embedded clinician or not, is that, you're not alone in this. We've got students here to help you. Faculty, I know, are always willing to help. I think that it's scary, especially if you're an out-of-state student, you don't know where you're going. And that applies to coming to undergrad. It's the same thing. You're never alone. Everybody's always there for you. Y'all are all going through the same thing. So,
well, and I like that about vet school, because it is like the class is a little community, because there are a lot of people coming from all different backgrounds, and being able to sort of find your people and offer support. And you had mentioned earlier about encouraging mental health care and therapy, and a lot of the referrals that I get are students saying, I went to therapy, it was really helpful, go meet with one of our embedded counselors. And so just word of mouth, and that it really is acceptable to, much more than it has been in years past to come and talk with a counselor or a psychologist.
Yeah, and we've talked a tiny bit about the awareness of mental health overall in society, in vet school, all of it. How do you see the role of mental health professionals evolving in veterinary education in the future? Do you see more schools going towards an embedded clinician route? Do you think that it would be helpful to have kind of a class, whether it's first year, fourth year, or both, on dealing with the academic stress of going through vet school, and then fourth year, maybe doing one with going into the field, finally transitioning from the school to practice, workloads and whatnot?
What I found is I've looked at like the top 15 vet schools, and most of them do have at least one embedded counselor, and that it's typically, rather than divided up into like, okay, we'll see the earlier career vet students versus the late, it's more we follow them throughout and sort of, help them to transition and kind of meet the demands as they increase, and, prepare for the next thing. And we do offer, I had mentioned outreach earlier and presentations, and so we do tailor those to the different classes and where people are in their curriculum.
Okay.
And to kind of prepare them. And then also the vet school does a really nice job of helping them prepare for like the next stage of their development.
Okay. Yeah, that's one thing that I've always kind of wondered about. Is that something that they prepare for in the way that a high school might prepare somebody to go to college and or the workforce? It's kind of scary to think about after 8 years of post-secondary education, just dropping off and going to work finally.
And going, now what?
Yeah, now what?
Right.
Now I have a real job.
Well, and one of the things that the vet school sent several of us to Texas A&M over the summer for veterinary healthcare communication. And so it was training faculty and staff to work with the students on how to have conversations and communicate clearly and effectively with clients. And so they're investing in even the non-technical or less technical kinds of skills, so that students do feel more prepared.
Yeah, that's super cool. That's another aspect of it that I didn't know about.
Right.
What have you learned and or most enjoyed from working with veterinary students that you didn't expect when you first started? Or that you did expect?
Right. I think I most enjoy being part of the veterinary medicine community and just being able to walk through the VEC and, seeing people that kind of in informal settings.
Mm-hmm.
And not just, when they come over and meet for a session, but, being able to interact with students in general and offer encouragement and support in a more informal sort of way, whether they come for therapy or not. But, you get to know a lot of the students pretty well. And since we are involved in all of the extracurricular activities and Vet Fest and those kinds of things. And so just being a presence that, because sometimes there are misperceptions about like what a mental health care provider is, and being able to say, we're just normal people, we're approachable. And so I've really enjoyed that aspect of being part of the community and establishing those relationships.
All right. And as we wrap up, do you have anything you'd like to tell our next generation of veterinarians?
To start now working on having that balance and to practicing good self-care, working on meeting their own needs. And this is the foundation that you will lay for yourself going forward. And you can do it at any time. You can always make changes. But I think if you start now, making sure to practice good self-care and making yourself a priority, which I know is a touchy topic when you said like how hard it is to get into a vet school.
Right.
But you're more than what you do, and you're more than the grades that you earn, and to invest in yourself.
Mm-hmm. Yeah, you are not your GPA.
Absolutely not.
All right. Well, pre-vets, this has been McKaylin and Dr. Christy Newberry. Good luck on your applications, and I'll see you for the next one.